Okay, thank you and good afternoon, everybody. I wanted to take a few minutes in this briefing to update you on our latest numbers, but also to share a few thoughts as we begin to relax our stay-at-home orders from St. Louis City and St. Louis County. So to be clear, the social distancing, hygiene, wearing face masks in public, and all of those other evidence-based practices we've talked about over all of these weeks that we've had shelter in place are going to have to continue to be essential in order to keep our transmission rates low as we allow some of our economy and society to begin to gradually reopen. Now, our region has made really significant strides in pushing the transmission levels down, and we can't let all of those efforts go to waste. So as we begin moving forward, we want to make sure we're being safe and that we're practicing all of those measures that have really helped us get to where we are. And that means continuing with the social distancing, with hand washing, keeping surfaces clean, all of those other practices. We have to take those very seriously if we want to be able to continue to open our economy and our society. And I'll share more about that here in a minute, but first let's share some current updates. So again, here is the hospital admissions rolling average, and it continues to show nice progress. So this is the trend in daily new hospital admissions that we've been tracking since early April. The rolling average still shows a steady decline since early April. And remember, this data is lagged about 2 days, and so the latest numbers that you'll see are based on Wednesday's admissions, where there were 24 new patients that were admitted with COVID. And the 7-day moving average fell to 26, which is our lowest point since we began tracking this data, so that's good news. So this is a really important trend, and it's an indicator of the level of suppression that we have of the virus in the community. And we, of course, want to see this number to continue to come down and stay as low as we possibly can going forward. We know it'll never reach zero, at least until we get vaccine, but we'd like to see it continue to come down. So let's move on to our hospitalization data. So our numbers continue to show good progress as well. So this is our daily hospital census of COVID positive and suspected COVID patients, as well as the rolling average. So today's rolling average is 505, and that continues to come down. It's also as low as it's ever been since we began tracking the data, and so that's really good news. Today's overall hospital census also fell. Today it's at 464, which is down from 488 yesterday. And we also want to see these trends continue to go downward and keep them as low as possible. So again, really good trending numbers we're seeing coming out of those two metrics. Here's our daily numbers. So as I mentioned, we had 464 hospitalizations today of confirmed COVID and suspected COVID patients, and that's down from 488 yesterday. We have 120 confirmed COVID or suspected COVID patients in our intensive care units, and that's down slightly from 121 yesterday. And we have 88 confirmed COVID and suspected COVID patients on our ventilators, which is up slightly from yesterday, where we had 84. And our good news slide, of course, yesterday we had 43 patients that were discharged from our hospitals, bringing our cumulative number to 1,827. And that's keeping track since we first saw COVID appear in our region. So again, this is always a reminder to thank our healthcare providers for helping get these patients well and seeing them back home. So a couple of things here. I wanted to show an updated inpatient model, and so you saw me show this on Wednesday as well. And as I said, we update these every Friday, and so these were the latest numbers that came in. And as you can tell, the numbers are tracking very well with our best guess model. And so numbers are declining. It's following very well with the curve. The yellow line is, again, if we had an increase in transmission, it would be a slower decline. But luckily, we're not on the slow decline. We're on our best guess. And so that's a really nice that it's following that model. And then the other one is our ICU patients. And again, you can see how initially during the pandemic, this number spiked pretty high and then began dropping fairly rapidly. And we're now back on where we thought we would be with our best guess scenario. And again, the orange line is if there was an increase in the rate of transmission, then we would actually see a slower decline in cases. And so that's really good news as well. And we feel pretty confident that we're tracking along with the right model. So now, as we're beginning this new phase in the pandemic, I wanted to share some of the slides that we had been using. I think we actually used this on our very first day, if I'm not mistaken. But this was a slide showing two models that we had run. The one in the orange is what we called our worst case scenario. And so that was based off of data that we had initially run looking at European models. And so, of course, that showed a much different picture than where we are right now. So much higher numbers of hospitalizations and, of course, more people in the ICU, and that would have meant more deaths as well. And then our best guess model was the one that we had built based off of the data that we were getting from all of our task force hospitals. And so we felt much more confident in that model because it was based on our actual data. And it turns out it's been pretty true. As you can see, our actual cases have been tracking very well with our best guesses. Part of that best guess as well is putting in place what we believe our transmission factor is. And so if you remember when I said when this pandemic first started, we thought we were around 5, then we dropped to around 2, and then we dropped to around 1. And that's really what has flattened this curve over time, is that decrease in the transmission rate. So let me show you another one now, and this is just to describe a little bit about this is what we do when we're looking at our hospitalization data, when we're looking at our admission data, and then when we're planning towards the future. The analytics team and the task force members are always debating what ifs, and so this is one of the what if factors. And so you may have seen this graph in the Post-Dispatch. I believe it was a couple of weekends ago, where we started planning on, okay, let's talk about now what this would look like if certain things happened going into the future. And so this was a scenario that we had produced looking at what would happen if after the relaxation of shelter in home, we actually bumped our reproductive factor up to 1.5. And so how does that happen? Well, that happens when people aren't doing the things that we ask them to do. If they're gathering in large groups, if they're not washing their hands, if they're not wearing face masks, all of those things contribute to the reproductive factor. And so we said, well, what would happen if people ignored all of that and we got this reproductive factor moving again? And as you can see, it bumps the cases up. In fact, the second wave would go higher than the initial wave, and that's absolutely what we don't want to happen. And so we use this for planning scenarios, and it's really for us in the healthcare system and public health and policymakers to understand what are some of the scenarios that we need to be planning for. Now, these aren't probabilities, so this doesn't have to be our reality, right? So our models are tracking well with how we're performing right now. And so we want to keep that transmission rate as low as we possibly can. And we believe that we can if everybody continues to follow all of those evidence-based practices that we've been advocating for. And so I will just run through those here on this next slide. And so those are things like staying 6 feet apart, wearing masks in public, washing your hands frequently or using hand sanitizer, making sure if you're sick that you either stay home, stay away from work, and see a healthcare provider, making sure we're cleaning our surfaces frequently, particularly for businesses that are planning on reopening on Monday, very important. Making sure that if you are one of those vulnerable classes, that you stay at home as much as possible. And so that's people that are over 65 or have other chronic diseases that put you at high risk. And then not visiting nursing homes, they're still considered high risk. We still see quite a number of patients that are coming from nursing homes and assisted living and things like that. And so we have to make sure that we're protecting them as well. And then no mass gathering, so no gathering of more than 10 people. And so if we follow all of these guidelines and we do it, as religiously as we can, then we feel confident that we can keep that transmission level low and that we won't experience that second wave. But it's incumbent upon all of us in the community. Everybody has to be practicing all of these things in order for us to keep the transmission rate low. Doesn't matter, where you live in our community or what the experience has been within your community. These are things that we all need to follow if we want to make sure that we're going to move forward in a safe and be able to open up different parts of the economy and the society, including all of those things we love to do. And so it's really incumbent upon us to make sure that we follow these rules so that we can then we can start opening up society more and more as time goes on. So with that, I'll close my remarks and we'll take some questions from the media.
Franklin County and several others have reopened already. Have they been open long enough for you to have any data to indicate whether there have been spikes of cases in any of those locations?
So they have been open longer, well, obviously longer than St. Louis City and St. Louis County. We haven't disaggregated the hospitalization or the admission data, though, to understand which patients would be coming from Franklin or from Jefferson County for that matter. And so I can't comment if we've seen more patients coming in to the hospitals from there. So I really can't answer that right now. Sorry.
More generally, with communities elsewhere in the country or around the world that have reopened, have any of those experienced a second wave of cases?
So there have been, to be sure. The one that's occupied the media quite a bit is the one in Singapore, where they clamped down really hard at the very beginning, were able to suppress the virus quite a bit. And then as they reopened their economy, they saw a spike in cases. But that was very dependent upon a special population in Singapore, where it was workers coming in from outside the country that lived in very dense living conditions. And so they were able to go in, test, isolate, quarantine, and get the transmission knocked back down. You may have heard also some cases in China, some in Germany, and a couple of other countries. But those countries had really, China aside, had good suppression measures in place. And so I believe they were able to address those really quickly. And that is part of the strategy going forward, too, is being able to identify where transmission is occurring, doing testing and contact tracing so you can really limit the amount of transmission going on in the community.
You have mentioned previously that as St. Louis County and City begin to reopen next week, it could take somewhere in the range of 10 to 14 days for evidence of a potential spike in cases to appear. How will you know if that occurs, where any so-called hot spots are, and how will the public be informed?
Yeah, it's a good question. So what we are going to be looking at is, of course, the data that you see that I present every time we do our presentations. We'll be looking at the index or the incidence of admissions, since that's really our earliest indicator, and seeing if there are any trends in that data. So we're working with our analysts and with our data scientists to see if there are other ways that we could look at the data to get as early of a signal as we can. As far as looking for hotspots, we're also using our data scientists and some of our other data presentation people to do more coding to look at where these admissions are coming from. So specifically, like on a map, where are these patients coming from? And if we can identify clusters, then we can work with our public health partners to say, hey, we're noticing some increase in cases from these different venues, whether it's from long-term care or specific communities, to hopefully get in there and do some testing and contact tracing and suppression measures. As far as letting the public know, we'll continue to show our data as we go along, and even though we've sort of stepped back a little bit from presenting every day, clearly if if we notice some changes in the data, we'll be reporting that.
What are your major concerns as we move into reopening on Monday in the city and county?
My major concerns are that people will equate relaxation of shelter in place with the virus is gone. That's absolutely not. That's not equal. The virus is still out there. It's still circulating in the community. There's still a significant proportion of the population that's susceptible to the virus. So the way that we can safely begin to reopen is if everybody practices all of those, techniques and things that we've been preaching in order to decrease the transmission rate. So, you may have seen footage over the last couple of days of people crowding into bars up in Wisconsin and places like that. That's absolutely the wrong thing to do. That is a surefire way for transmission to get kicked up and for us to be right back where we started from. So do not equate removing shelter in place with virus is gone. It's still out there. Our job is to keep transmission as low as we possibly can.
Do you feel as though area residents have taken seriously your warnings to continue hygiene and distancing best practices?
I do, just from my own observations, I do. So I go, to the grocery store and other places, and I notice people are wearing masks. They're socially distancing. They're taking all of those precautions very seriously, and so that makes me hopeful that people are taking this seriously and that they will continue to take it seriously moving forward. So we can prevent any second waves from happening.
Thank you. That concludes the list of questions received from members of the media prior to and during today's briefing. Over the weekend, the task force will provide updated numbers via press release. The next live stream will take place Monday afternoon. Thank you.